Hi, everyone. I'm going to start with a non-COVID story update at this point. I just wanted to share, and I know that I had some questions already, and it's probably known that we are now hosting in Cornwall about 520 or so evacuees from Deer Lake. As you know, there have been multiple fires raging in northern Ontario for the last couple of weeks, and late last week and over the weekend, there were evacuations to multiple sites in northern Ontario and to Cornwall. And as usual, we work with our partners at NAV Centre, who are the receiving site, and we work with our health providers to provide on-site screening and ongoing medical care. The operation has gone smooth so far. I just wanted to summarize some of the questions that we've been getting. Yes, there has been, obviously, we do all the COVID screening, no COVID cases. The vaccination rates are quite high, and we're actually continuing the vaccination process here. We're providing on-site services, medical care, and so on. The Red Cross is there as well. It's a usual operation for us, except it's done during COVID at this point. We have low cases here. There were no cases there when they came down. So we're monitoring the situation, working with our partners, working with the provincial and federal government as well, obviously locally with our primary care providers, home care providers, our LIN, our hospital, and so on, EMS. Everybody's involved in receiving them, screening them, and ongoing care moving forward. Again, this is not new to us. The population, most of them are a lot of young children, and so they're free to travel within Cornwall. They go to parks and so on. We are not sure how long this operation will be, but we have been, like I said, used to this, and it's just at this point they've settled in, and we may get a few other evacuees, but I think it's at the limit at this point. And so I just wanted to share with everybody that they are here, and we're not sure how long they'll be here, but we have been providing the usual care and support through our multiple healthcare, social providers, and so on. So I just wanted to say that, and there, like I said, there are a lot of children playing in parks around the Cornwall area. There's like I said, we feel bad. These people have been pulled out of their homes, but again, there's no choice. Raging fires still raging, huge smoke concerns. The fire is about 20 kilometers from Deer Lake. In fact, I think they're all evacuated at this point. So I'm going to go talk about COVID right now. Again, cases are low. The one sporadic case here and there. I think we're up to 4 active cases total in our area. No hospitalizations, no outbreaks in congregate living settings. And so I'm going to spend most of my time talking about vaccinations. As you know, this has been a major concern of ours and preoccupation. So I will be sharing my screen because I want to go over a PowerPoint presentation that I've updated for you, so we can get some semblance of some of the numbers where we are this week as compared to last week. We have now administered over 240,000 vaccines, close to 241,000 vaccinations. We are at 142,000 plus people who have had their first dose, at least the first dose. That represents almost 80% of our 18 plus population and close to 78% of our 12 plus population. In terms of second doses, we are at 98,541 second doses, which brings us up to 57.1% of 18 plus and 54% or so of fully vaccinated 12 plus. One of the things that I just wanted to point out again, you can see this diagram here shows us that we've been administering both Moderna and Pfizer. We're getting a lot of Pfizer this week as well, so we'll have plenty of both Pfizer and Moderna on hand moving forward. It's going to give you some other breakdowns now, how they break down individually and by percentage. You can see here as well that we are now based on age groups, and as I've said before, our lower age groups have less of an uptake. uptake, although it's increasing steadily. We're close to 58% of 18 to 29-year-olds and 55% of our 12 to 17. We're struggling. It's going up slowly. We'll talk about some strategies for that a bit later. And you could see, understandably, the second doses are lagging, but we are achieving high doses in individuals who are in the elderly age group. And I'm going to talk a bit about later about some vaccine hesitancy and some of the strategies that we'll be looking at as we try to achieve, high levels of immunization in our community. When you're looking at our total again, you can see that through July, we're outpacing June. We're more than halfway through, and we're more than half of vaccinations delivered. Compared to last week, we've delivered more vaccines, obviously 21,000 more vaccines this week as compared to the last week. And you can see it's shared with most of them are mass immunization clinics. Pharmacies are averaging between 500 and 700 a day, which is very good. And our primary care are also delivering between 100 and 300 a day, as are our hospitals as well. When you break it down to between first and second dose, you could see that right now we've reached 142,453, which represents 80% of 18 plus and 78% of 12 plus. And you can see that out of the 44,000 we delivered, 4,000 were first dose. And you could see so it's about a 2,000 increase from last week. That we don't need much to go to that 80% figure for 12 plus, and I will talk a bit about that later when I look at targets and so on. And if you look at second dose, we delivered more than close to 20,000 second doses, and you can see again where we are with our 18 plus second dose and our 12 plus second dose rate. As you can see, our doses are going up in Ontario and in Canada as well. As a matter of fact, I think we're over second dose percentage compared to the United States. And so this is good moving forward. This is a new chart that I put up here, and I've calculated it. And these are goals. Now, the goals here are that we want to achieve in order for us to go to the next step. Right now, we're in step 3. This is the first week we're in step 3. It started on Friday, as you know, and we wanted to have the government has put out some guidelines for what would be the next step. In other words, removing more restrictions as we get past step 3, which would be in the week of August 6th, I think, at that point in time, if you look at it 3-week intervals. They have set overall average of 80% of first dose and 75% of second dose. And where we are now with first dose, you can see we've delivered 142,453. So we're just shy of 4,000 doses. We're delivering 2,000 doses a week. So I have no issue with us reaching that between now and August 6th. Where we are with second dose, and you can see we lagged because we started the second dose really a month or two after the first dose starting to be delivered. You can see that with the 75% is second dose attainment, and our goal based on 12 plus population. I want to stress this is 12 plus population, which is all eligible individuals, 12 plus, and so our goal is 137,250, which represents 75%. Right now we're at 98,500, which was a shortfall of about 38,000. So that is something that we're looking at, and we know that over the next couple of weeks, I can tell you that between now and the end of July, we have 21,600 spots in terms of our clinics, just our mass immunization clinics, notwithstanding the about roughly 3,000 per week that are delivered through primary care and pharmacies, if not more. And so right now, out of the 21,600, we have about 14,000 that are already booked. So we have about 7,500 openings. So and they fill up. I know they're starting to fill up. So when I'm looking at those numbers, adding some of the pharmacy numbers, we will be able to make a substantial dent into not only our first dose but also into our second dose, approaching that 75% mark as well. And so some of the strategies that we're doing is to promote, and we want people to go get their second dose, is we just did a press release and we've emailed individuals. Initially, we had 16,000 individuals who had their appointments after August. Now it's about 11,000, and we're asking them to move their appointments earlier. We're getting help by the ministry as well. We're going to do some calls to those individuals to move it earlier, because we're planning to phase out mass immunization clinics in August. And I will talk about what's going to happen afterwards. But right now, so that's one of the strategies, to move those people up. And also basically working with a lot of the partners, community partners as well, looking at ambassadors, looking at other things to start looking at our younger age group, particularly less than 30 years of age. We're doing some targeted approaches in terms of, for example, today we did a pop-up clinic in Hawkesbury where we had over almost 200 people just walk in, high-risk individuals, vulnerable individuals. Over the weekend on Saturday, we had a walk-in clinic, which we had almost 500 people that walked into our clinic on Saturday. And all of our clinics moving forward are that are listed on our website and are really almost daily between now and the end of the month. We accept walk-ins from our area. So those are the type of things that we're doing. We're working with our college. We have reached out to St. Lawrence College to ensure that we can have on-site vaccination for their age group. We have reached out to workplaces as well to see if we can facilitate on-site vaccines, or they can distribute the message of how vaccines are important. We're also working with our school boards to do two things. Number one, we are going to be reminding parents through the school boards to get their children vaccinated. And also we're planning on looking at, for example, going into the schools as early as September to either catch up on vaccines or provide vaccines on site as well. So there are a lot of things that we're trying to do to increase those numbers. But I do think that, again, if in terms of the first dose and getting the second, people getting the second dose, we'll be able to go those numbers. Now, I want to stress that those numbers are numbers for us to progress from step 3 to beyond step 3. From the epidemiologic point of view, in other words, if we want to really fend off and community, in other words, establish herd immunity, we would need to be at a higher level, 85, 90% vaccination rates. And so we do know that probably between 5 and 10% of the individuals will be completely resistant to the vaccine, but we want to go get those. So if we're at 75 or 80%, I want to go get those other 10%. And this is where we'll be working again through agencies, social service agencies, adding clinic, allowing people to do walk-ins, working with our primary care, trying to get more primary care. If people want to have a second opinion from the doctor, if they're hesitant, and so on. Working with all these strategies moving forward to be able to do that. And of course, once we stop our mass immunization clinics, pharmacies will be available. Obviously, to the vaccine will be available at pharmacies. We're also going to have clinics like we have flu clinics. We're going to have the same by appointment in all of our 6 offices. So the vaccine, it will go on beyond August 6th, but those goals are interim goals, more for stepping into beyond step 3, pardon the pun. And so we are going to still be working, even if we reach, which I think we will, that 75% mark of second dose of fully vaccinated. We're going to be trying to push it higher to the 85, 90% area by those activities. And that's why there'll be persistent activities, persistent efforts on our behalf to be able to move those vaccines forward. And so, like I said, the individuals who've already had the second dose vaccine beyond August, we'll push them up. And if for some reason they're not able to, there's plenty of availability for them to get their vaccine either at our office, in doctors' offices, or at any one of our more than 40 pharmacies that are carrying the vaccine. So I think that's quite important because again, we want to get the message out. Please get vaccinated. The quicker we get vaccinated, the higher we'll be able, the quicker we'll be able to go back into that normalcy. But it's also important because what we're seeing now is that this is a pandemic of the unvaccinated. 99%, if not more, of admissions to hospital and so on and cases are actually in unvaccinated individuals. And so particularly with the Delta variant, we're seeing Delta variant outbreaks in the United States. Don't forget, in the United States, there are pockets of the population where millions of people are not vaccinated, despite millions of people being vaccinated. So those millions are fodder for the virus. So we're seeing outbreaks in the United States, we're seeing outbreaks in Florida, seeing outbreaks in the UK among the non-vaccinated. So the more vaccinated we have, the less we will have a chance of getting a resurgence and a fourth wave with Delta, which is what we're seeing in other countries, because Delta is much more easily transmissible, but it is preventable with 2 doses. And so that's what we're trying to achieve. The higher the number of people vaccinated, the less of a chance of having a resurgence of the virus and the Delta. We will have, and I keep stressing that, let's say we reach 85, 90% of a population. Don't forget that the vaccine doesn't work 100%. We'll get breakthrough cases, but not to the point where we'll have to close down the economy, not to the point where we'll be overwhelming our hospitals. So that's why it's important for us to continue. Despite that, if we reach that number in August of that, 80% first, 75% second, we want to get it a bit higher and work towards getting it even higher so we can assure that we don't have to close the economy and we don't have to look back anymore. Bonjour tout le monde. Je vais commencer avec des nouvelles qui ne sont pas reliées tout à fait avec COVID. Comme vous avez déjà peut-être entendu, nous avons reçu à peu près 520 personnes qui ont été évacuées du Deer Lake, nord d'Ontario. Il y a des incendies importantes qui ont forcé l'évacuation de Deer Lake et 4 autres communautés d'Autochtones au nord d'Ontario. Donc, ça a commencé la semaine passée, jeudi, vendredi, qu'on a reçu, et pendant la fin de semaine, nous avons reçu à peu près plus que 500 personnes, plutôt les jeunes mères avec les enfants, au NAV Center, et en collaboration usuelle qu'on fait avec nos partenaires de santé communautaire, des centres de santé communautaire, les hôpitaux, l'AirList, etc., la ville de Cornwall, paramédics, etc. L'équipe usuelle, nous avons fait un dépistage à la rentrée et ils sont là, la Croix-Rouge est là pour supporter ces personnes qui étaient évacuées. Bien entendu, le taux de vaccination est plus que 75% et nous avons des plans de même vacciner les personnes qui n'ont pas reçu la deuxième dose. Donc, on va les faire vacciner. Il n'y avait aucun cas de COVID avant qui ont quitté. Par contre, on prend toutes les précautions. Donc, j'aimerais juste souligner qu'ils sont là. On est habitué à le faire avec les personnes. On a des personnes qui sont évacuées à cause des inondations. Comme vous savez, on a reçu des passagers de croisière de Japon en février passé aussi. Donc, on est habitué à le faire à NAV Center. Mais cette fois-ci, c'était pendant une pandémie. Donc, on a toutes les précautions. Peut-être vous allez voir autour de Cornwall les personnes qui vont peut-être aller au parc avec leurs enfants parce qu'il y a beaucoup d'enfants. Donc, ne soyez pas surpris si vous les voyez. Je ne sais pas la durée, comment il va rester à Cornwall, mais je peux vous dire que selon les dernières nouvelles, l'incendie est à peu près 20 km proche de Deer Lake et beaucoup de fumée. Donc, ils ont presque évacué tout la ville. Je pense que 9 personnes restent, mais donc, on ne sait pas la durée au NAV Center, mais on est habitué et on va continuer à le supporter ici sur terrain. Donc, au niveau de COVID, je peux vous dire que ça va bien dans notre région. On a à peine 0 à 1 cas par quelques jours. On n'a aucune flambée, on n'a aucune personne hospitalisée. Donc, ça, c'est toutes des bonnes nouvelles. Donc, on doit continuer. On a rentré aux 3e étape, comme vous savez, la semaine passée. Donc, tous nos efforts maintenant sont vraiment dédiés aux campagnes de vaccination qui vont bien. Donc, je vais vous partager mon écran pour vous démontrer un peu où on est rendu avec les vaccins. je vais commencer ici. Donc, en général, donc vous voyez ici, on a vacciné presque 241 000 personnes, donc 142 453 ont reçu une première dose, à peu près 80%. Et vous voyez ici, ça représente à peu près 78% des personnes plus que 12 ans. Au niveau de deuxième dose, on a vacciné plus que 98 000 personnes. Ceci représente 57% des personnes de 18 ans et plus et 54% à peu près des personnes à 12 ans et plus éligibles pour la vaccination. Je vais vous en parler un peu des chiffres ciblés tantôt, mais vous voyez ici, on a différents, on a Pfizer, on a combinaison de Pfizer et de Moderna. On a reçu à peine beaucoup de Pfizer cette semaine, donc on a en masse Pfizer et Moderna pour les gens, donc il n'y a aucun problème. Donc, si on va par âge, vous voyez ici comme sûrement comme première dose, les personnes plus que 30 ans, on a beaucoup plus, 75% et plus. Bien entendu, on approche 100%, 96, etc. aux personnes âgées, qui est une bonne chose. Et on commence à voir aussi une augmentation de deuxième dose. Donc, on voudrait aller au même chiffre que première dose pour donner la deuxième dose. Mais vous voyez, avec l'âge, on va le taux de vaccination qui va en diminuant, surtout les personnes en bas de 30 ans. Par contre, on voit que ça augmente un petit peu au 18 à 29. 57,9% et 30,9%, mais on voit encore sur les 12 et 17, le plus bas, 55%. Donc, ça augmente de façon lente, mais je vais vous en parler des stratégies que nous allons implémenter bientôt pour qu'on puisse augmenter le débit de vaccination, surtout dans les personnes de 30 ans et moins. Au niveau des premières, donc vous voyez ici, la semaine passée, on était à 219, donc ici, on est à 240. On a vacciné à peu près 21 000 personnes depuis les dernières fois, depuis la semaine passée. Donc, et vous voyez, en mois de juillet, on a vacciné 44 000 personnes. C'est un peu plus que la moitié de la dernière. Donc, on pourrait envisager qu'on va vacciner au moins un autre 40-45 000 d'ici la fin juillet, d'ici les quelques 2-3 semaines. Donc, on voit sur la prochaine qu'on est rendu à 142 000 personnes vaccinées et vous voyez la semaine passée, première dose, et vous voyez ici, la semaine passée, on était à 140, donc on a vacciné comme première dose à peu près 2 000 personnes depuis la semaine passée. En total, nous avons vacciné 7 mois 4 100 personnes avec leur première dose. Et donc, ceci, comme je l'ai dit tantôt, ça représente 78% les personnes de 12 ans et plus et 80% les personnes de 18 ans et plus. Donc, au niveau de la deuxième dose, vous voyez ici qu'on est rendu à 98 000, donc il y a 20 000 plus que la semaine passée, dans une semaine. Donc, ça, c'est un très bon débit. Donc, vous voyez que la plupart des vaccins qu'on a donnés en mois de juillet, soit 40 000 sur 44 000, étaient la deuxième dose. Ici, nous avons, on a ciblé, le gouvernement a ciblé comme but d'aller aux prochaines étapes, de sortir de la troisième étape et en effet d'avoir beaucoup moins de restrictions. Donc, dans 3 semaines, donc à peu près la semaine de 6 août. Donc, ils ont dit qu'on devrait le faire seulement quand on est à 80% de la population qui avait reçu la première dose et 75% des personnes ayant reçu la deuxième dose. Donc, vous voyez ici, actuellement, on est à 142 453 pour la première dose. On est à peine en bas de 4 000 pour l'avoir. Donc, avec un débit de 2 000 par semaine, à peu près, on va l'atteindre d'ici quelques semaines. sûrement au niveau de 12 ans et plus. C'est ça que je veux dire. On est en total, notre population est 206 000. 12 ans et plus, c'est 180 000 dans notre région. Et vous voyez, comme deuxième dose, on va avoir 75 soit 137 000 à peu près. On est rendu à 98 000 à peu près ici. Donc, ça nous prend à peu près 38 000 doses. Donc, ça, c'est le défi que nous avons, mais je suis confiante qu'on va atteindre parce que vous voyez, la première dose, on a donné 146 000. Je vois ça très difficile de ne pas atteindre au moins 137 000, au moins. Je vais parler tantôt au niveau de nos buts idéaux épidémiologiques. Mais j'aimerais juste parler un petit peu des choses qu'on va faire. Premièrement, il y a à peu près 11 000 personnes qui ont eu la première dose dans mars-avril, qui avaient un rendez-vous après mois d'août. Donc, on va les contacter pour qu'ils puissent avancer le rendez-vous parce qu'on aura peu des vaccins de mass immunisation après le fin août parce qu'à ce moment-là, on va avoir un autre modèle. Je vais en parler tantôt avec ça. Juste pour vous donner une idée, nous avons d'ici entre le 20 et 30 juillet, on a 21 600 places disponibles pour le vaccin. Déjà, presque 14 000 sont bookées, donc ça nous reste à peu près 6 000 réservations qui vont être complètes, qui vont prises, à mon avis. Donc, vous voyez, donc on envisage dans les prochaines 2 semaines, 10 jours, en effet, de donner à peu près 21 000 doses nous-mêmes. Donc, et avec le débit de à peu près 3 000 doses par semaine au moins entre les soins primaires et pharmacie. Donc, ça va nous rendre à peu près 30 000 plus de vaccins. Donc, vous voyez, on va approcher les 70-75 de deuxième dose au niveau de la population de 12 ans et plus. C'est ce qui est le but d'ici le 6 août pour qu'on puisse rentrer aux autres étapes. Je veux dire aussi qu'une fois qu'après le mois d'août, nous allons continuer. Ça ne veut pas dire qu'on aura peu de vaccins. On va offrir le vaccin dans nos cliniques de bureaux de santé, dans nos bureaux, comme on fait pour l'influenza, mais ça va être offert aussi aux soins primaires et ça va être offert aussi on a une quarantaine de pharmacies qui vont continuer à l'offrir. Il faut dire que nous avons des défis avec les personnes, les personnes, surtout 12 à 17 ans. Donc, on a des différentes stratégies pour aller le chercher et à chercher les personnes qui sont résistantes et vont hésiter ou ils n'ont pas de place, ils ne peuvent pas prendre rendez-vous, il y a des problèmes techniques, etc. Déjà, tous nos cliniques, on a des sans rendez-vous. Par exemple, aujourd'hui, on a fait une qui a à peu près 200 personnes à Hawkesbury, au Legion. Samedi passé, on avait aussi une clinique qui était au Benson Center. À peu près 500 personnes sans rendez-vous sont présentées. Donc, ça, c'est des choses pour faciliter l'accessibilité aux vaccins. Nous allons faire les cliniques mobiles. Nous allons faire les cliniques spéciaux dans les régions vulnérables, etc. Nous avons utilisé les médias sociaux, les ambassadeurs, etc., les influenceurs, si vous voulez, pour les plus jeunes. On va parler avec les écoles. On va demander aux parents, rappeler aux parents de faire vacciner leurs enfants. On va rentrer aux écoles, aussitôt que ça commence, pour offrir les vaccins aux personnes aussi, juste pour être sûr qu'on ne manque personne. Avec le collège de Saint-Laurent, on va faire la même chose. On va rentrer pour vraiment capter, essayer le plus possible d'aller vacciner les personnes qui sont, on voit le débit qui n'est pas suffisante, à mon avis. Donc, ça, c'est des choses qu'on va faire et je suis confiante qu'on va les atteindre. Je veux juste dire que les indicateurs, les pourcentages ciblés du ministère, soit le 80 première dose et 75 deuxième dose, sont uniquement pour nous laisser progresser à la prochaine étape. Ne sont pas idéales sont pas vraiment les buts qu'on veut nécessairement au niveau de l'épidémiologie, en sachant que le Delta virus, dans la plupart du monde, c'est ça qui cause les hospitalisations. Je peux vous dire que plus que 99% des personnes qui sont atteintes de COVID actuellement sont des personnes qui ne sont pas vaccinées. Donc, le pourcentage de personnes qui sont vaccinées, c'est très important pour jouer un rôle de protection communautaire, herd immunity, comme on dit en anglais. Et à ce moment-là, c'est pour ça que, malgré que, oui, on va atteindre le 75%, le 80% de première dose et 75% de deuxième dose, on ne va pas arrêter là. On va continuer à pousser, on va aller chercher. Honnêtement, c'est à peu près 5 à 10% des personnes qui ne vont pas se faire vacciner, n'importe quoi qu'on fait. Mais on va aller chercher, il y a 10% qu'on peut aller chercher. Donc, on va faire le mieux pour le faire. On va continuer les efforts, on va continuer de les convaincre, on va continuer avec différents moyens de les faire vacciner parce que le plus qu'on vaccine les gens, le moins qu'on va avoir des problèmes qu'on voit aux États-Unis. Vous voyez, aux États-Unis, ils sont à 50% actuellement de vaccination. 50 ou 58%, en tout cas plus bas que 60%, en effet plus bas que nous au niveau de la deuxième dose. Et vous voyez, donc si on compte, ils ont 300 millions de personnes et plus, si 50% ne sont pas vaccinés, le virus a 150 millions de victimes qui ne sont pas protégées. Donc, c'est rendu en une pandémie pour les personnes qui ne sont pas vaccinées. Donc, le plus qu'on pourrait vacciner les gens, le plus qu'on va atteindre un succès. N'oubliez pas que malgré que si nous, on vaccine 75, 80% ou 85% de nos personnes, la pandémie n'a pas arrêté. On est en pandémie mondiale. Donc, ça prend vraiment que l'attention. On va continuer à vacciner le plus possible et pour qu'on puisse pas avoir une quatrième vague comme on voit en Angleterre, aux États-Unis, en Grèce, etc. On le voit. Donc, on va toujours avoir les petits vagues, mais ça ne va pas affecter beaucoup de gens, ça ne va pas hospitaliser, ça ne va pas nous forcer de fermer l'économie. Donc, c'est ça la vie qu'on va avoir d'ici jusqu'à temps que la pandémie va arrêter, mais ça n'arrive pas cette année. Mais au moins, nous, avec la sécurité le plus haut pourcentage qu'on peut atteindre, ça va être notre sécurité aussi, notre protection globale, communautaire dans une situation globale. Okay, I'm just going to go to some of the questions here. Toronto Star asked me about the 12-year-olds, and I answered that. Got another one about masking indoor environments. At this point, masking requirements are still there, regardless of vaccination status. As we get to a high enough vaccination rate, those things will change. And I can tell you that at one point there will be masks only for individuals who are not vaccinated and individuals who themselves are immunocompromised or dealing with immunocompromised individuals, and in situations where you have multiple big crowds indoors. And again, that will depend on the epidemiology and the rate of infection in the community and the rate of vaccination, obviously. I have another one here about information is spreading among some members of the business community. Well, James, I can tell you that 10% will not believe what I tell them. So I'm trying to get the 90% out there that are convincible and we can discuss vaccinating. There will be 5 to 10% that will be hesitant and resistant. So at this point, we're going to try to concentrate as much as possible to change our minds. But I think that there's misinformation out there, but we're trying to do our best to share the information. Another one here. Yeah, options about after our clinics. I've talked about those. And I had another question about the Deer Lake, and I've talked about those as well. So, Nick, we can go to the media for questions.
All right. The first question is from Philip Blanchard, Morrisburg Leader.
Good afternoon, Dr. Paul. In arbitrarily cutting the clinics after August 27th and forcing about 16,000 people to rebook their appointments to an earlier date, do you believe this is going to hinder some of the second dose vaccinations you would have otherwise captured?
Not at all. Not at all. No, I don't believe so. And it's not, the reason we're doing it is because we need to go into some kind of a steady state. And that was the plan all along. when we vaccinate a certain percentage of the population, how do we get that extra 10%, which I talked about? So that's the reason. And the other reason too is, again, it's very difficult for us to keep up with all. We're doing, 8 different sites. We're taking the arenas. People want to use their arenas and so on. So there's a lot of reasons for it, but I don't believe so. Those 16,000 people, by the way, are shrunk down to 11 because we moved 5 already up. And so there's only 11,000 people left. And I believe that that's not a hindrance. And indeed, I wanted you to know that if for some reason they don't get their vaccine, for some reason they're out of town or whatever happens and they can't get their second dose, there will be opportunities to get the second dose. It's not that we're closing shop completely. It's just that we're changing the way that it's going to be available.
Okay. Last week you said that there was, if there was supply, that people could choose Moderna or Pfizer at an EOHU clinic. What are your supply numbers like for each of those right now? And is that an option that's viable at most of those clinics?
As of this week, we have supply of both, plenty of both. Yeah. And we will respect people's opinion, unless we have no delivery, but we're expecting a lot of Pfizer and a lot of Moderna as well.
Okay. You also said that last week that you'd be looking at more clinics in marginalized areas or more of the rural areas. Not any more details on clinics, when they might be happening, whereabouts they might be, any kind of firm deadlines with that?
We don't have anything firm. We actually have a mobile unit now that we're going to be dedicating to doing those things and going around, and we have looked at other areas, and so we're just in the process of arranging that. We have actually an ambulance that was donated to us that we'll be using as a mobile clinic, and we'll be going around and being able to reach those populations. And again, that's the type of people that's the type of areas we're going to be doing. We're not abandoning that at all. Even if we stop our mass immunization clinics and there's need, we will be doing that.
Okay, and just the last one, because it hasn't been approved yet, but for the under 12s with Pfizer or Moderna, whichever one gets first, you're looking at possibly a fall immunization, depending on when it gets approved. Have you got any kind of firm plans yet on how you would handle that, or any kind of insight of when that might be?
Yes. What I know is that there is a task force, a pediatric vaccine task force in Ontario, and they're reviewing the data themselves. I know that Pfizer is going to likely apply for approval likely by the end of the summer. And so I anticipate that there will be an approval in the fall sometime. I'm not sure when. We are poised and ready. We're working with our school boards already. Discussions are underway of how we can then go into the schools and vaccinate. Obviously, it's a different situation. Right now we go into the schools, as you know, and we vaccinate grade 7 and 8s for, meningitis and hepatitis. And the parents don't need to be there. But obviously for a 6-year-old, 7-year-old, the parents are going to want to be there. So we're working with the schools to look at what the best model is. Do we go after, do we do after school clinics? Do we do weekend clinics? So we can get them there, and we'll be doing it school by school. So that's very important for us. And we want to, again, make it as easy as possible for parents and their kids when the time comes, which I'm pretty confident will occur in the fall sometime.
Okay, thank you.
No problem.
Next question comes from Denis Babin, Radio-Canada.
Bonjour, Dr. Roumeliotis.
Bonjour, Denis.
Ottawa a annoncé que la frontière sera ouverte aux Américains pleinement vaccinés à compter du 9 août. J'aimerais vous entendre là-dessus, puisque le Bureau de santé dessert une région frontalière.
Oui, mais je m'attendais à ça. Au moins, on aurait l'obligation d'avoir les 2 doses. Comme je dit tantôt, Denis, que c'est rendu maintenant que la pandémie est une pandémie pour les personnes qui sont non vaccinées. Donc, j'imagine avec les précautions, avec quelqu'un qui est double vacciné, et je pense qu'ils vont avoir encore des autres types de dépistage. Je n'ai pas entendu qu'est-ce qu'ils ont fait spécifiquement au niveau à la rentrée, le test, etc. Je pense qu'avec tout ça, ça va être sécure. Ça va, d'un côté, augmenter le débit de tourisme dans notre région, qui, comme vous voyez, on avait un problème, mais d'économie, tout ça. Mais je pense qu'avec les précautions en place, c'est inévitable que ceci va arriver.
Donc, vous êtes confortable avec ce qui est proposé, là?
Oui.
Merci beaucoup.
Pas de problème.
Next question comes from James Morgan, The Review. Go ahead, James.
Hello, Doctor. I just wanted to clarify my I asked this question similarly last week, but I'm just trying to get the details straight on it. about the vaccine, if you received Pfizer for first dose and Moderna for second dose or vice versa, is it completely up to the individual arriving at a clinic to say if they want the same as the first, or clinic staff, are they obligated to offer the option?
No, when we have no, we will let them know what we have, and if there's an option, it will be offered. And sometimes we had no Pfizer. As you know, we had no Pfizer. We had more Moderna. But people will ask, and we'll tell them. We're not going to force people to get what they don't want.
Okay.
If they don't want Moderna and we can't convince them to, then they'll come back another time.
Right. I just know of one individual who said there seemed to be a bit of confusion about it at the one particular clinic they attended. So that's good.
We've ran multiple clinics just with Moderna. We had no issue.
Okay.
Thanks.
Good to know. Thank you.
Thanks.
To those joining by phone, have any questions? You can press *6 to unmute. Ceux qui se joignent par téléphone, avez-vous des questions? Vous pouvez appuyer la touche étoile 6 pour désactiver le mode silencieux. Looks like those are all the questions for today, Dr. Paul.
Thanks, everyone. Merci tout le monde. Bye-bye.